Good evening, folks. It's a great day to learn about Medicare. Hi, my name's Daryl Russell, and I'm with Affordable Medicare Supplements. We're an independent agency that helps you learn Medicare, how it works, how to avoid mistakes. I'm also the sales director here at Affordable Medicare Supplements, or AMS for short. Again, we try to help you learn Medicare. We have an agency here in Overland Park, Kansas, and you're watching this class from our video studio setup within our office. We're glad to bring it to YouTube as our platform because with these classes, you can still ask questions via YouTube chat on your laptop, or if watching on a smart device like a TV, which may not have the chat option, you can still text your question to Justin at his direct line, 913-214-1361 during the class, and we'll keep that number up on the screen during the class. It's also automatically recorded, and the recording will include timestamps to each topic covered to make it easier for you to go back and find the segments you're most interested in. And we always include links to any websites or forums in the description box below. Today we're going to go over Medicare Parts A, B, C, and D, as well as how and when to enroll to avoid mistakes and penalties. Plus, we're going to review the basics of coverage options like Medicare Supplements and Medicare Advantage plans. After all that, we'll run through a couple of scenarios to test your learning. And at the conclusion of the slideshow, we'll open up phone lines here in the office, and we'll actually be able to take questions live via the phone. Finally, we'd like to give you some guidance on how to plan your next steps and how we can possibly help you with that. If you like our video, please give us a thumbs up and maybe consider subscribing to our channel. So let's get started, shall we? Okay, let me get a few things going here. Too many buttons to push at the one time sometimes, folks. Here we go. Okay, so again, we're going to go ahead and get started with our program here. So today we're going to talk about learning Medicare, subtitled Medicare for the Soon to Retire. Again, my name's Daryl Russell. I'm a licensed agent, and I'll be presenting your class today. I'm a big believer in using credible sources. So a lot of the stuff that we're going to go over today, we're actually going to reference chapter and verse, the page numbers from some of the official government publications on Medicare and Medicare supplements. We also have a very effective resources page on our AMS website. So for example, if you were just to go to our current web page, which is simply amskc.com, here you'll see the helpful resources page, and we've got a lot of good information available for you to download free and easy. This is just a quick screenshot of what you might find. Okay, let's keep moving, shall we? Okay, so there's 4 parts of Medicare, and we're going to talk about all of them, A, B, C, and D. If you notice in the slide here, I've got a red line dividing the 4 parts of Medicare. Because A and B, this is all what's called original Medicare, and this is all run through CMS, the federal agency that manages Medicare. So Part A covers your hospitalizations, and Part B covers your medical insurance, or what we would call today doctors, outpatient services, that type of thing. Now, Part C, Medicare Advantage plans, and then Part D, prescription drug plans, they're separated because these are all run by private insurance companies who are under contract to CMS to run them for the Medicare program. Okay, one of the more common things we get, sometimes people are concerned, is how am I eligible for Medicare? Well, you become eligible for Medicare one of 3 ways. The first day of the month that you turn 65, even if you're not retired. After 24 months of receiving Social Security disability benefits, regardless of age, you automatically get Medicare Parts A and B. Also, some people can be diagnosed with rather severe illnesses, things like ALS, Lou Gehrig's disease, end-stage renal disease, permanent kidney failure requiring dialysis. And at those diagnosis of those diseases, you get Medicare Parts A and B within usually 4 months of diagnosis. It's important to keep in mind that even though Part A and B are separate, you do need to keep both Parts A and B and always pay your Part B premium to be fully insured under the Medicare program. Okay, so that's the quick overview. Now let's take a look at Medicare Part A. What do I get for my Part A? Well, Part A is going to give me coverage for inpatient hospitalization. So that currently in 2020 has a $1,408 deductible per benefit period. After you satisfy the deductible, there's a hospital copay, and for the first 60 days, that is zero, so that's manageable. Should you go beyond that, it goes up to $352 and then on to $704 for days 91 through 150, your lifetime reserve days. But I think most people would agree it's pretty hard to use up that many days of hospitalization nowadays. In addition to your hospital, Part A also covers skilled nursing home. Your copay is zero for the first 20 days of skilled nursing facility. This would be after a fall or surgery where you're going to get rehab to get better and go home. After 20 days, it switches to a copay of $176 per day that you would pay. Medicare pays the rest to a total of 100 days in care. Medicare Part A also provides coverage for home health care. There is no copay, but be cautious, folks. It is very, very limited in what they'll do. And then hospice for the terminally ill. So altogether, that's what you get under Part A of Medicare for coverage. Okay. So then the follow-up to that is, well, what does it cost me? Well, most people do not pay a Part A premium, and that's because they had 40 quarters or 10 years of Medicare-covered employment, and you paid enough taxes while you were working that you don't pay for Part A once you're retired. If you have less than 40 quarters, you can see there's premium amounts listed for Part A based upon your work history. Okay, so that's what I get for Part A. Now let's go ahead and take a look at what you get with Part B. Again, Part B covers your outpatient medical coverage, and currently there is an annual deductible of $198. And with Medicare Part B, the deductible, always think calendar year. This will change every year slightly. Most people pay the standard premium for Part B of $144.60 per month based upon income, and we'll talk a little bit more about that here in just a little bit. Typically, you can pay your Part B premium either through Social Security deduction if you are drawing Social Security benefits. Many people are pushing them back beyond age 65. So if that's the case, the Medicare agency will send you a quarterly bill, or you can authorize automatic monthly payment from your bank or checking account. So Part B includes, after that deductible, Medicare pays 80% of what they approve, and you as a member would pay the other 20%. And this includes things like your doctor visits, outpatient therapy, durable medical equipment. That would be things like wheelchairs, hospital beds, oxygen equipment, CPAP machines, emergency room visits, most outpatient services like a same-day surgery, maybe needing an MRI, CAT scan, that type of thing. So that's what you get with Part B. It is very comprehensive. There is no cap on how much your 20% can add up to in a calendar year. There is no lifetime maximum on that. Now, I wanted to go a little bit and help clarify a few things, though, because it's no big secret that doctors today and most medical providers bill substantially more than Medicare or just about any other insurance approves. How does that work with Medicare? Well, if your doctor bills $250 for a comprehensive visit and sends that to Medicare Part B, Medicare might receive that bill, but they might say, well, we only approve $100. Assuming that you've already satisfied your deductible under Part B, Medicare is going to pay 80%, which in this case would be the $80, and you as a member would pay the leftover, which is $20. The amount over what Medicare approved, that $100 over that, is all written off by the provider. Nobody owes that, so it's not an obligation you need to worry about. That's commonly referred to as an example of Medicare assignment. Okay. So some of the things that are not covered by Part A and B of Medicare, long-term care, most routine dental or vision, hearing aids, that type of thing. Occasionally people will ask about acupuncture or cosmetic surgery, prescription vitamins. These are not deemed to be medically necessary, so they're just not included in Part A and B. And we have referenced the Medicare website if you want to look up additional things. Those are the more common ones. Now, nowadays we need to talk a little bit about how you actually enroll into Medicare Parts A and B. For some people, it's automatic. If you're drawing your Social Security benefits when you're turning 65, you'll be automatically enrolled into Medicare Parts A and B. You'll get a card roughly in the mail 90 days before your birthday, the month that you turn 65, and you're good to go. Other people need to sign themselves up. So if you're not drawing your Social Security benefits, or if you're a railroad retiree and you get benefits through Railroad Retirement Board, then you will have to go and manually sign yourself up. And you can do this as many as 3 months before the month that you actually turn 65. And what surprises a lot of people is you do not have to be retired. We talk to people all the time that are working somewhere, either self-employed or they got a part-time gig or even a full-time job, and they take Medicare benefits. So here I pulled up a screenshot of the Social Security website. Now, Social Security and Medicare are two separate agencies, but on signing people up for Medicare, they're joined at the hip, as the expression goes. Back in the 60s when Medicare was new, there wasn't any Medicare offices, but the government was paying for all these Social Security offices. So they just put it into the law that Social Security will help handle the paperwork, the application. So in case you're wondering why, that's your back history on that. So if you go to ssa.gov, and again, we'll include the links automatically in the description box down below. But on the home page, you'll see this button here that says Medicare Enrollment. Okay, whoops. And once you click on that, and then scroll down a little bit, it'll talk about applying online for just Medicare. And again, occasionally folks are waiting to draw their Social Security till age 67 or 68, and they get a little nervous about that. If you read this, it tells you this is for you to sign up for Medicare only. It doesn't do anything with your Social Security. You just come down here and click this blue button. They'll ask you to identify yourself, set up a socialsecurity.gov account, but then you can very quickly and easily, in less than 10 minutes, fill out your Part B enrollment online. And if you're not a big computer fan, you can have somebody else help you. We've occasionally helped customers in the area with this as well. We've got plenty of computers here in the office. All right. So one of the things that you need to understand is the timing. What are my time windows that I have to sign up? So when you're new to Medicare, we've got your 65th birthday month down here. Medicare gives you a 7-month enrollment period or a 7-month time window to do the application before any type of late penalties or bad things happen to you. So if you look at the month you turn 65 as your center point, you can actually do your paperwork 3 months before you turn 65, and your Medicare goes into effect the first day of that month that you turn 65. And that's what we call our no delay period, as you see up here, okay? If you wait till the month you turn 65, or in the 3 months after, you can still sign up and you're not subject to a late financial penalty, premium-wise. But there is a delayed start to when your Medicare A and B goes into effect, okay? So here I took a screenshot from the Medicare webpage, and it explains that a little bit. If you wait until the month you turn 65, let's say you turn 65 in August, just because this is August. If you are signing up now on August 18th, then your Medicare A and B would be effective the 1st of next month or 1st of September. Okay, not a big deal. But if you wait till September, 1 month after, then your coverage is effective 2 months after that month you signed up, and September isn't one of the two. So that means October, November, you're not eligible till December 1. So there can be some effective date issues, and we've got a nice video recorded on our YouTube webpage, short lessons on how Congress actually has a bill in Congress that would simplify some of that. So you might want to look up that video. Okay, so I've effectively talked about that. Let's keep moving on. Okay, forgive the Homer Simpson graphic here, but everybody wants to know, how do I avoid late penalties with Medicare Part B? That's one of the hot topics we have. Okay, well, your Part B late enrollment penalty is a penalty you're incurred for not signing up when you were eligible during that 7-month initial enrollment period that we just went over. And the government adds a 10% premium surcharge for each full 12 months that you could have had Part B but didn't. And this will go for as long as you have Part B. You can only sign up during the January 1 through March 31st time frame. And even if you do the paperwork January 1, when you're signing up late, your Part B doesn't become effective until the 1st of July after that period ends. Now, keep in mind that if you delayed your Part B coverage because you had coverage through an employer that either you or your spouse was actively working for, then the Part B penalties do not apply because you had other credible coverage. So we'll take a quick look at what is a Part B late penalty example. So I've just made up Mary here. She delayed Part B for 2 full years when she was eligible. And in red, you notice she did not have employer coverage. She just didn't want to pay the premium, didn't understand how it works. Now she's decided to sign up, and because she has 24 months, 2 years, she has a 10% for her first year, 10% for the second year, or a total of 20%. So it looks like this. In 2020, the standard Part B premium is $144.60. 20% of that is $28.92. So we add those two together, it comes to $173.52. However, Medicare always rounds up to the next dime. So they go $173.60 is now the premium penalty. So that 20% will also be applied to any future Part B premium increases. And typically Part B premiums for standard Medicare will rise every year, every other year, something like that. So it is something you want to avoid, but just know if you have employer coverage, it's typically not an issue, and we can always help you with those and in that regard. Okay, something else that occasionally can hurt, especially some of our higher income folks, is the Part B IRMAA. Well, IRMAAs are income-related monthly adjustment amount, and it's based upon your AGI or your adjusted gross income from your federal tax return 2 years ago. You can appeal if you disagree or have a life-changing event. This is Form SSA.44, and we keep those on our resource page. And also, your IRMAAs are paid directly to CMS, the federal agency that manages the Medicare program. So what does that all look like? Why are you making a big deal of this, Daryl? Well, here's the chart. And again, you can get this on our helpful resources page. But the standard premium in 2020 is $144.60, and that assumes that as an individual you have an income under $85,000 or a joint return of $170,000. But if your AGI goes over by 1 penny, then you can see your Part B premium goes up substantially, and you can see the columns, the thresholds for the different incomes. And yes, we do have on occasion people that are paying close to $500 a month for their Part B premium. Obviously, it's a good problem to have, but it is something to be aware of. It is a 2-year rolling look back, so starting January of 2021, it'll be based upon your AGI from 2019, 2 years in reverse. Favorite topic. More and more nowadays, people are working beyond age 65. You're eligible for Medicare at 65, but many times people's full Social Security benefits won't start till age 66 in 6 months or 8 months or what have you. So commonly we get asked about, well, how does working beyond age 65 affect my Medicare decisions? Well, first of all, you kind of need to make a little bit of a decision at that time frame. Do I stay on the employer plan? And some of the more common reasons people will do that, they've got a younger dependent, a younger spouse, maybe they still have younger children living at home that are covered under that plan. In some cases, the cost is cheaper, more comprehensive, or they may just have a personal preference, so they can delay their Part A and B, typically at least B, and stay on the employer plan. But sometimes if you do the math, it may actually be less expensive in terms of your premium payment and more coverage to go off the employer's plan and sign up for Medicare Parts A and B. On occasion, I've talked to people that were paying $500 a month through their employer and thought it was a good deal, and we could get them substantially less premium on a Medicare plan and put $200-300 a month back in their checkbook. So always ask. And worst case, you can always ask your employer, if I go off the employer plan, he's not paying your insurance or she's not paying your insurance, they might give you an increase in pay. Never hurts to ask, right? Another thing to keep in mind, though, with working beyond age 65, and this applies mostly only to people who have a health savings account or HSA. So these are the accounts where you can put money in tax-free. You don't lose it if you don't use it. It rolls over every year. Part A premiums for most people are no charge. But if you, under the current tax laws, until Congress changes this, if you sign up for premium-free Part A and you're continuing to work and wanting to put money into your health savings account tax-free, Part A may cause you a problem if you take it. Working beyond age 65, typically it's a good decision to delay enrolling in Part B unless your employer has less than 20 employees. We're going to talk about that. But if you're wanting to put money into your health savings account, you want to make sure you defer Part A, even though there's no premium charge to it. So another thing I want to talk about on the same subject here is working beyond age 65. When should I delay my Part B? Again, the key is, as long as you are still working, or if you're covered through a spouse, that spouse is still working for that employer, then it can be to your advantage to delay Part B of Medicare. But, and we're going to beat this horse into the ground, coverage based on current employment does not include COBRA, retiree, VA, or individual coverage like Obamacare plans. TRICARE, if you're 20 years of active military service and retired, thank you for your service, but you're also eligible for TRICARE for life. That generally requires that you do keep your Part A and B as well. We can answer questions about that if you have those. So this chart here, and keep in mind, I told you we'd reference it. You'll find this on page 20 of the 2020 Medicare and You booklet. It just goes over how other insurance works when you have Medicare. So for example, here it talks about you have retiree insurance. You're no longer working for that employer, but they've extended insurance coverage to you as a former employee. Medicare pays first. They're the primary payer. And under the current laws, you must have and continue to pay for Part A and B in order for everything to work right. But now the second one says if you're 65 or older, have group health plan based on you or your spouse's current employment, and keep in mind that employer has more than 20 employees, then your group health plan is the primary payer, Medicare is secondary, and you can, under that scenario, delay enrolling into Part A if you have a health savings account, or Part B if you just don't want to pay the premium, and there's a good reason not to overpay. And there's additional things there. But again, you can find that all on page 20 out of the 2020 Medicare and You booklet. So what happens when your employer coverage ends? You said I only had a 7-month window to sign up. Well, you'll get a special enrollment period that allows you to sign up without any late penalties or delayed coverage within 8 months of when you lose that employer's coverage based on yours or your spouse's active employment. Why 8 months? Because that's the way they wrote the law. Most people don't wait that long, but that's what you can do. And again, if I haven't beat it into the ground hard enough, COBRA or retiree coverage are not based on active employment, and you will not get a special enrollment period if you delay your Part B for those reasons. And you're signing up in the general enrollment period for July 1 effective date, and signing up in the general enrollment period is typically always bad. We want to try to avoid that. So let's go ahead and take a look at what you get under Medicare Part D drug coverage. Well, first of all, there are 2 ways that you can receive coverage under Part D. Option number 1 is to pick a standalone Part D drug plan. These are usually as a companion when you're using your red, white, and blue Medicare card. These are all offered by private insurance companies, and you have many options. In fact, here in the Kansas City area, we've got over 28 different standalone Part D plans for you to evaluate. The second option for Part D drug coverage is you could get drug coverage built into a all-inclusive Medicare Advantage plan. These are sometimes referred to as Part C, and we're going to talk a little bit more about these later on. Currently, there are 32 Part C or Medicare Advantage plan options just in Johnson County, Kansas alone. Okay, so how am I eligible? I know I'm eligible for Medicare based on age 65, but what do I have to do for Part D? Well, to be eligible for option 1, the standalone drug plan, you simply have to enroll into at least Medicare Part A with or without Part B. Doesn't matter. As long as you have Part A, you can pick a drug plan if you need one. To be eligible to join a Medicare Advantage, the all-inclusive plans, then you typically must have Part A and pay your Part B premium, be enrolled in that. You also have to live in the Advantage Plan service area. This is generally a county specific or sometimes zip code, but usually county. And you do have to pick a plan, whether you do a standalone or whether you do an Advantage plan with it all included. You always have to pick a plan, fill out the application, and enroll. Nothing is automatic where Part D drug plans are concerned. Now, this is the standard benefit. This comes right out of the Medicare and You booklet. Part D plans, some people are still concerned about the coverage gap or the donut hole. We're going to talk about that. This is here. But under standard Medicare drug plan, let's say you buy one and a standalone, you have a monthly premium for that plan. And then you start off with a phase 1, stage 1, which is a yearly deductible, and all Part D benefits, think calendar year, January 1 through December 31st. So even if you're new to Medicare in the month of October and you sign up for a Part D drug plan, you have a yearly deductible for October, November, and December. Okay, and then it starts over again the following January. So currently in the year 2020, the highest the deductible can be is $435, although some plans may make it smaller. Some plans may even eliminate the deductible altogether and charge you a slightly higher premium. So that's stage 1. Then once the deductible is satisfied, then you go to stage 2, which is what's called the co-payment or co-insurance phase. And during this area, you'll pay a co-payment and the plan will pay the rest, or in some cases, a co-insurance percentage, until the total amount for the cost of all the drugs, including what you paid in deductible, reaches $4,020. Should you use that all up in a calendar year, then you go into the coverage gap or the donut hole. And when Part D first started in 2006, you had to pay 100% of the cost in the coverage gap. It's now changed dramatically. The laws have changed. You still have coverage. You pay a 25% coinsurance for brand and generic drugs, and then the total cost plus some of the discounts are used to calculate if you've had a lot of drug coverage and qualify to move into the catastrophic coverage where your copays go down dramatically. Now that's the technical part of it, and if you're most people, you're doing one of these right now, going, what, huh? So let me give you Daryl's free-flowing translation. So you pick a Part D plan, and once coverage begins, you're given a checkbook to pay for Part D drugs for the remainder of that calendar year. The checkbook has $4,020 in it, and you can't put more money into your checkbook. The total cost of your drugs is deducted from your checkbook balance every time you fill a prescription, even if there's a deductible applies or you pay a portion, whether it's a flat co-payment amount or a percentage called a coinsurance. For example, you go in and your drug costs $100 just to have a nice round number. Your plan has no deductible, so even if you have a copay that you paid of $25 and the Part D plan paid the other $75, the total cost of the drugs, $100, is subtracted from your available checkbook balance. So for as long as you have an available balance during the calendar year, each time you go to get a prescription, you pay the copay only, and the plan pays the rest. So if you're worried about, am I going to run out, the total for the calendar year in 2020 is $4,020. That's how much they put in your checkbook, for lack of a better term. Divide that by 12 months in the year, and you would have to spend over $335 every month on average for 12 months to use up that $4,020. But if you do, then you go into the donut hole. And again, the coverage gap, when it first started, you had to pay 100% of the cost of your medicines back in 2006 when Part D first started. But now the law has changed and you pay only 25%. The plan pays the rest, regardless of brand name drugs or generics. What you pay and your 25% in the coverage gap and 95% of the discount that you get on your brand name drugs only counts as out-of-pocket spending and helps you out of the coverage gap. These amounts go into a bucket that they call for true out-of-pocket. We have specialized computer softwares that can help figure this stuff out for you. Most people don't typically run into this, but if you take very high-cost drugs, some of these injections you see on TV for all types of things, they're $1,100, $1,200, $3,000 an injection. It's kind of crazy. So, but those are typically how people reach these levels. So if you do reach that true out-of-pocket of $6,350 and there's calendar year left, then your costs go way down to only 5%, or $8.95 for each brand name, $3.60 for each generic, whichever is the higher amount. And again, with all of your Part D Medicare options, everything starts brand new every January 1. So Part D drugs are covered as long as they are given in the USA. They have to be USA originated drugs approved by the FDA. You can't use your Part D plan to get a drug from Canada or Ireland, something like that. We get asked a lot about, insulin. Yes, those are covered under Part D. And each plan has their own rules. And again, we have some special software that can help you understand those things. Now, another thing to consider when you're looking at Part D plans is formulary. If you're concerned about your medicines, each plan will have a formulary or a list of all the drugs that are covered, and that list will tell you what your copayment amounts will or won't be. The formularies can change every year. In fact, if you know someone who's on a Medicare plan, here in the month of September, they're going to receive their ANOC notice, annual notice of change. That's a big, kind of like a phone book almost, that goes through all the changes of the plan, and it'll say whether this drug was a Tier 1 this year and it's moving to Tier 2, which might mean a higher copay. So you always want to pay attention to that. Now, there are some things that are not covered by Part D. You can see the screen, more common things: weight loss, weight gain, ED drugs, the Viagra, Cialis, those types of drugs are not under Part D. Occasionally we'll get asked about prescription vitamins or fertility drugs, hair loss treatments, that type of thing. Unfortunately, none of those are covered under Part D. Okay, so that's kind of trying to move along here quickly. Part D late penalties. So if you don't sign up for Part B like boy, we talked about that penalty, you're not required to take a Part D drug plan. But if you change your mind later and decide to enroll and didn't have coverage, you can be assessed a premium penalty. Now, this higher premium is 1% of each month that you could have had Part D drug coverage and chose not to, and did not have credible drug coverage somewhere else. Currently, the base premium is $32.74, and this is a number that CMS, the federal agency that manages Medicare, determines every year based on the average cost of a Part D plan. So this base beneficiary premium can and usually does change every calendar year. Now, again, keep in mind, you're not assessed a Part D late enrollment penalty if you delayed coverage or didn't enroll in Part D because you had credible prescription coverage somewhere else. And here we have some of the more common examples of what credible drug coverage can mean. You had coverage for prescriptions through a former employer or union plan. If you're active duty or you're military retiree and you have TRICARE with their drug coverage, you're not going to be enrolled in a Part D late penalty if you change your mind and want to add it. Same as with Indian Health Services, Tribal Health, VA drug coverage for all our servicemen and women, as well as individual coverage under Obamacare. Now, let's go ahead and change gears a little bit. There is a IRMAA, that's that income-related monthly adjustment amount, applies to Part D drug plan premiums based upon the Medicare beneficiaries' earnings. So here again, we have a similar chart. This is also a 2-year rolling look back. So in 2020, if your income is a joint is below 170, husband and wife, or two people, spouse jointly, or an individual under 85,000, your Part D premium is strictly what your plan charges, this YPP. But if you're 1 penny over, you pay your plan's premium plus an additional $12.40 all the way up to almost $80. And again, it's a 2-year rolling look back, so if your income drops down in subsequent years, it should go away. So we talked a little bit about the high income. Well, let's take a look at what Medicare does for people with lower income. What are some of the special rules? Extra Help is not an insurance program. This is a government entitlement. You apply through Social Security, or you can call 1-800-MEDICARE and they'll take your application over the phone. We can also help you here in the office if you'd like our help, but it basically is for folks with lower incomes. It will eliminate or reduce dramatically your Part D premium if you pay a standalone premium, and in some cases will dramatically reduce or eliminate your copay or your co-insurance amounts. Here we see a chart that shows the 2020 income levels. So for an individual below $1,595 per month, $2,155 for a husband and wife, that's your income, and you don't have financial resources going over these dollar amounts, you may qualify for the Extra Help. Savings and investments is what they look at. They don't look at your home, your car, funeral burial plots, that type of thing. And we can help you with that, but you can also do it directly by calling 1-800-MEDICARE. They'll take it over the phone. And I highly encourage people, even if you think you're on the edge, go ahead and give it a apply. It's not going to goof up anything that you got going on. So while we're talking about Extra Help for lower income, sometimes folks get confused between Medicare and Medicaid. So I wanted to talk about Medicaid and how it's different from Medicare. You qualify for free or low-cost coverage through Medicaid based strictly upon your income and your family size. Age has nothing to do with this. In all states, Medicaid provides health coverage for low-income people, families with children, pregnant, the elderly, and certain people with disabilities. It's always tied to income level, okay? So while Medicare and Medicaid sound the same, Medicaid is more based upon income. Medicare is you're 65 or older, or you've been on Social Security disability for 24 months, or you had Lou Gehrig's disease or end-stage renal, getting kidney failure treatments, dialysis. So while they do sound the same, Medicare and Medicaid, they're very, very distinctly different, and most Medicare beneficiaries do not have Medicaid at the same time. All right, so now we're going to change gears, and we're going to take a look at, okay, I've got Medicare Part A, Part B, you've gone over D, you skipped Part C. Well, this is where we're going to catch up. So we're going to look at how private insurance company options like Medicare Advantage and Medicare Supplement come into the picture, and some of the questions you want to ask yourself, or one of the things you need to know when evaluating these types of coverage. So you're in the Medicare and You booklet, it'll tell you at the very beginning that there's 2 ways for you to get your red, white, and blue Medicare coverage. Option 1 or option 2. And this is, there is a dividing wall. So you either have one or the other. They do not mix. So let's start with option 1, which is I'm going to enroll into Original Medicare. I'm going to use my red, white, and blue Medicare card. I'm going to have Part A and B, and I'm going to pay the Part B premium. Now, I have all the deductibles of Medicare, but first I'm going to go to decide, well, secondly, do I want to get a Part D standalone drug plan? So if I do, I pick my plan, enroll in it, and I'm going to pay my Part D premium. So I've got my red, white, and blue Medicare card, paying that premium for Part B. I've got my Part D card. I got a separate premium for that. And then thirdly, I can decide, do I want a Medicare Supplement plan that helps cover those deductibles, the coinsurance, the copayments that my red, white, and blue Medicare card leaves behind? If so, I'll evaluate which plan I want, fill out the application, and I'll get a third card and I'll have a third premium. It works very, very well, but that's option number one. My other option is to go to a Medicare Advantage or Part C. Now, this is Medicare, but you start off by enrolling in original Medicare Parts A and B, and you always have to pay your Part B premium. And you can choose to enroll in a Medicare Advantage plan offered by these private insurance companies. Again, they have to have a contract with the government. They typically include your Part D drug built in. So you end up with one card. When you're on an Advantage plan, you no longer use your red, white, and blue Medicare card when you go to the doctor for as long as you have that Advantage plan coverage. There can be an additional plan premium, but people are often surprised to find that Medicare Advantage plans do not come with a monthly plan premium. They're not free, they're just not charging anymore, and we'll talk about that. Typically, one of the things that people need to consider with Advantage plans is they will have a network, either an HMO or a PPO, and these are the list of network doctors and hospitals that you can use the plan at and pay your copayment when you access care. So let's take a deeper dive into option one, which is the Medicare Supplement route. Okay, so I'm going to have my red, white, and blue Medicare card, pay my Part B premium, and regardless of my Part D drug options, I'm going to buy a separate supplement. Well, first of all, it's always important to know when you do your budget that your premiums for the Medicare Supplement are going to increase with age. Now, all Medicare supplements by law are what's called guaranteed renewable, which means as long as you pay your premium, you cannot have your coverage canceled on you. The insurance company can't raise your coverage, or raise your premiums, single you out because you have poor health. They can only raise rates if everybody who has the exact same plan gets the exact same increase. And all your Medicare supplement plans are now standardized. They have been for many years, which is basically trying to make it easier for you to price compare. You can look at a Part A, Plan X, Plan F, Plan G, Plan N, whatever from company X, Y, and Z. The coverage will be the same, but you'll see the premium varies widely. Now again, with Part D drug, they do not include it in a Medicare supplement. So when you buy a supplement, if you wish Part D coverage for prescriptions, you have to get a separate standalone plan. Now this chart comes from page 70 of the 2020 Medicare and You, and when I talked about Medicare supplements being standardized, if you've done any kind of shopping or looking, you've probably had someone throw this chart in front of you for Medicare supplements. And a little description here, we can spend a little bit more time on it one-on-one if you've got questions. But in this column here under the benefits, these are the leftovers that your red, white, and blue Medicare card leaves you as a Medicare beneficiary to pay. The Part A deductible, B deductible, excess charges, so on and so forth. And so a standardized Plan A pays 100% of the first 4 items, but leaves you to pay all the rest for these bottom ones. So if you're looking at an A from company X, Y, or Z, the benefits are the same, use just a difference in premium. Plan F has been very popular in the years. Currently, we probably have more people looking at Plan G or Plan N, sometimes a Plan L in that regard. So when you apply for your Medicare supplement, if you apply within the first 6 months of your Part B effective date on your red, white, and blue Medicare card, you cannot be turned down because of health history. After your Part B is effective for 6 months, then the Medicare Supplement companies can and will often ask you health questions to determine if they want to take you or not. Now, what many people find attractive about Medicare supplements is that there are no networks. There are no networks with Medicare supplements because your red, white, and blue Medicare does not have a network. As long as that doctor is willing to bill the red, white, and blue Medicare card, you can use it and the supplement has to pay. So whether you're in Kansas, Missouri, you take a trip to Florida, you got you're a snowbird, you live in Arizona, Texas, Florida parts of the year, your Medicare card and your supplement work just fine no matter where you are. And you don't need referrals or Mother May I slips to see a primary care doctor or from your primary care doctor in order to see a specialist like a heart doctor, bone doctor, that type of thing. Now, with your Medicare supplement, again, depending on the plan type you get, they're going to cover all or most of your Medicare deductibles and coinsurance, depending on the plan you select. Plan G right now is extremely popular. It picks up everything Medicare leaves behind with the exception of that Part B once a year deductible of $198. So some people really like the convenience. They don't mind the large premium because they know as long as they pay their premium, all they've got for, in this case, a Plan G, $198 out of pocket for the Part B deductible. After that, everything's taken care of. With Medicare supplements, I get asked this question frequently. Is it group? No, it's one. So each spouse, if you're a spouse, have a husband and wife, each spouse will have to get their own separate policy. Okay, so that's the unexciting part about Medicare supplements. Let's look at option 2, Medicare Advantage. Well, many people are surprised about Medicare Advantage because it is a dramatically lower premium than combining a Medicare supplement, commonly referred to as Medigap, and their Part D plans are usually included in an Advantage plan. But you have benefits, costs, premiums that can change every year. And again, Medicare Advantage is Medicare. They have to cover all your Medicare approved services. So, surgeries, hospitalizations, anything that is covered by red, white, and blue Medicare card has to be covered under an Advantage plan. In some cases, you may actually find that an Advantage plan includes extra benefits that you don't find in red, white, and blue Medicare card or most Medicare supplements. Things like dental, vision, hearing aid, and there's a bunch of other things we'll talk about more in depth. The trade-off is when you're using a Medicare Advantage plan, these are network-based, meaning you'll have a list of doctors that you can use for the plan to work, HMO or PPO, and we'll talk more in depth about that. This is a pay-as-you-go plan. You'll pay a copayment or a coinsurance each time you use the plan. I got an example there, a $10 copay each time for an office visit. So if you're used to insurance that you have now at work and you've got a copayment for this, a copayment for that, Medicare Advantage will look very, very familiar to you. So as I mentioned, Medicare Advantage plans all are network-based. So you'll have the most tight network, the most restrictive is the HMO, the Healthcare Maintenance Organization. You must get permission slips, Mother May I slips I sometimes call them, from your family doctor to see a specialist. You'll have the lowest copayment and the lowest overall cost, but you have a much smaller network usually to pick from. And if you go out of your network, you see a doctor who doesn't bill the HMO, unless it's an emergency and you were taken there because you had no choice, in an HMO Advantage plan, you have no coverage when you go see a doctor out of the network except for emergencies or when traveling under urgent care. Now, again, you need prior authorizations, not for office visits, but it's not uncommon if I need an MRI or I might have an elective surgery, certain procedures. The plan may ask my doctor to put in documentation ahead of time why it's medically necessary I have that. And some people don't like that. You do get extra benefits sometimes, dental, vision, and hearing coverage, and it can be quite good. And there's a lot of different extras. Again, it's not bad, it's not good, it's just different. So in the same token, some Medicare Advantage plans have PPO networks. And typically, we probably find that most people, if they're looking this way, they tend to prefer the PPO. Why? Well, you have a little bit more copayment when you access care, and you, again, typically will have your Part D drugs built in, but it's a much broader network of medical providers. So I've got more doctors, hospitals I can pick from. And should you go out of the network, I prefer to see Dr. Smith, and he's not a contracted on the list provider, but he's willing to build the plan. You still have coverage, you just might have a higher cost because you went out of the network. So, and a lot of times PPOs give you the options to use that company's network in another state if you're a snowbird. With PPOs, you still may sometimes need prior authorizations in order to access certain medical procedures, the more costly ones, but you never need referral to see a specialist. It's much less restrictive. And in many cases, you may still find those extra benefits like dental, vision, hearing, gym memberships, that type of thing. So if I can break it down to be a little bit more simpler, in an HMO, you're going to have usually the lowest cost, but its smallest network, most restrictive. You may have a lot less control over some of your decisions. In a PPO, Medicare Advantage, people find they pay a little bit more in copays, but they have a much larger network. They can go out of the network. They have a lot more control over their decisions. And it seems to be a lot more popular for those folks that consider Medicare Advantage. Okay, so now we've touched on the networks. We need to understand how this all works, because people are shocked sometimes to hear they can get coverage through a Medicare Advantage with Part D at no premium depending on the plan. It's not science, it's not magic, it's that Medicare actually pays a monthly premium, for lack of a better term, every month to these Advantage plan companies if that's who you choose to get your Medicare coverage from. And these plans must agree to follow all of Medicare's rules in order to receive those federal funds. So when it's a zero premium, it's not free. They're just not charging you any more than they get from the government. And keep in mind, you pay the Part B premium to the government, and that's part of the money that Medicare Advantage organizations receive to provide you with your care. Now, your Advantage card for billing purposes is your Medicare card if you choose this option. You keep your red, white, blue Medicare card safe, keep it at home, but you only show doctors and hospitals your Advantage plan card if this is what you choose. And you're typically locked into the plan for the calendar year, but every year in the fall upcoming, you can switch from company X to company Y. It's very, very common, very simple to do. So how do I qualify for Medicare Advantage? What are the rules? Well, number one, you must live in the plan service area. Usually it's county specific, and you must continue to be residing in that county. You have to sign yourself up for Medicare Parts A and B, and you always have to pay the Part B premium to the government. There are no health questions associated with Medicare Advantage because it is part of the Medicare program. In 2020, the only health question that they're allowed to ask is, do you have end-stage renal disease, permanent kidney failure requiring dialysis, you're waiting on a kidney transplant, you're a very sick individual. This restriction is actually lifted starting January of 2021. So anybody can enroll in a Medicare Advantage plan if you live in the area that it's offered, and have your Part A and B. Okay. Well, Daryl, that's all well and good, but how am I supposed to choose which way I want to go? Well, we have specialized software. We can help you with cost and premium quoting, but here's a little quick review. If you choose Medicare Supplement, you're basically choosing prepaid convenience. I don't mind paying that monthly premium, whether I receive care at the doctor's office that month or not, because I know in exchange for that monthly premium, I have very little or no out-of-pocket medical cost each time I go to the doctor, the hospital, same-day surgery, what have you. And I like the flexibility of knowing any doctor who bills red, white, and blue Medicare can bill my supplement. I'm not worried about networks and all that kind of stuff. One of the drawbacks of Medicare Supplement is they can only pay, again, they supplement Medicare. So if original Medicare denies a claim, typically so will the supplement. So you always got to keep that in mind. Now, I put together a rough cost estimate. Again, I'm just trying to give you some ways to try to start doing some homework on your own. But if you're on the Kansas side, a Part G, a Plan G Medicare supplement would be roughly $125 a month. It might be a little bit more, a little bit less, but I'm just using a conservative number here. If you add a separate Part D drug plan, that's going to be another $20 on top of the supplement premium. So that's $145, and if you got 12 months in the year, then that means it's costing you $1,740 in premium for the supplement and your Part D drug. Your out-of-pocket cost for medical under a Plan G is capped at the Part B deductible for doctor services, which is currently only $198. And then after that, Medicare pays the supplement picks up 100% of all the costs that Medicare leaves over. So if you add $1,740, what you pay in premium, plus the deductible, you've got a guaranteed out-of-pocket spend of roughly $2,000, just under, not counting your Part D drug copays. There is no separate benefits for dental, vision, or hearing, so you would pay those out of your pocket on your own, but you're not having to put up with networks. If we look at Medicare Advantage as a contrast, again, this is pay-as-you-go. It's still Medicare, but you're getting your coverage through the Advantage plan, and your premium is, for lack of a better term, is the cost of your copay when you receive care, and Advantage plans have a limit on how much your copays can add up to. Now, these copays and limits can change every calendar year, and as long as you understand and you're willing to accept the networks of doctors and hospitals available through your Advantage plan, you may get more benefits, things like dental, vision, hearing, so on and so forth, but you're going to pay a copayment every time you access care. So here I put up a fairly significant example. So let's say you chose an Advantage plan, and in the calendar year, you had a 0 monthly plan premium. Okay. But you had 12 doctor visits for the year, and your plan had a $5 copay. Well, that would be $60 in total expense for those copays. Maybe you had a copayment of $50 each time you saw a specialist, and you saw your heart doctor once every 90 days. Maybe you ended up with a hospitalization, and your plan had a copayment that for 3 days added up to $870. You had a couple of trips to the emergency room. You even had a trip by ambulance. Well, you would have copays for all these types of things. Now, this is fairly significant, and if you add it all up, it comes to $1,620. If you see less services, you're going to have less copayment. It's just a matter of, are you willing to accept the network, and do you understand how the copays work? So there really is no such thing as better when you're talking Medicare Supplement versus Medicare Advantage. They are simply different, and you just want to think with Med Supp, I've got upfront fixed costs in my premium versus maybe costs with an Advantage plan. And you can switch between them. People do this all the time. Election periods, which we're going to go over, may limit the time windows that you can do this. Health questions may and often do apply when you're switching from an Advantage plan into a Medicare Supplement, so that is a consideration. There are never health questions when you're switching from a Medicare Supplement to a Medicare Advantage. So MA there means Medicare Advantage, forgive my jargon. All right, so let's step back and take a breath here real quick. Hopefully you're enjoying what we're doing. If you do me a favor, consider subscribing. Maybe even remember to give us a thumbs up if you like the video. It does help other people find our materials, so keep us in mind. All right, so let's move on to enrollment periods. What's an enrollment period? Well, enrollment periods are the time windows, basically, that you have under the Medicare program if you want to make a change. Once your time window or enrollment period closes, typically you've got to wait the next year before you can make another change. So let's take a look at some of the more common time windows or enrollment periods. So I've got the nice little I'm new, we've all been new at a company somewhere, And when you're new at a company, what do? They give you so much time to review materials, decide if you want to sign up for insurance or if you want to waive off. Well, this is that initial enrollment period that we talked so much about before early on, that 7-month window, the month you turn 65, 3 months before, 3 months after. Well, you use that to sign up for Part B, but you also have a separate IEP to pick your Medicare Part D standalone plan or an Advantage plan if you go that way. Once your window closes, if you didn't select coverage, you'll wait for next year. If you wanted to switch but you didn't do it, the window closed, you got to wait another year to make that switch. And again, this is that 7-month window here when it comes to you're new to Medicare. Okay, now I put up here time for change. Soon to be coming up, this is August, today's August 18th. Soon coming up is the Medicare Annual Open Enrollment Period. This happens every fall. It starts October 15th through December 7th. Because Part D plans and Advantage plans, even Medicare itself, A and B, will change a little bit every year. Co-payments go up, premiums adjust, so on and so forth. And so companies will be announcing in October what their plan benefits and premiums are going to look like the following January 1 following calendar year. And if you want to switch, change to all kinds of different things, you can make as many changes as you want during the annual enrollment period, October 15th through December 7th. If you make a change, it becomes effective the following January 1. But here's the key. If you're happy with the plan you have, you've looked at your change notification and all the changes are acceptable to you, you don't have to do anything. The plan you like that you stay in will automatically renew and you're good to go. But there is a mulligan period for us golfers. That's my do-over. Now, this is a open enrollment period that starts January 1 to March 31st. Now, this is only a switch period, and it only applies to people who have Medicare Advantage plans. It gives them the option to disenroll from that Advantage plan, switch to a different one, or go back and get a drug plan with original red, white, and blue Medicare. You won't see this advertised. It's more meant as a oops period. Oops, I meant to do something in the AEP, and I got caught up in it. Finally is the special enrollment period. Something special has happened to me. These are things that come up during the year. Special enrollment periods usually last for 63 days. And you'll see here some of the more common special events that trigger this time window. I was enrolled in an employer's plan beyond age 65, and I've lost that employer's coverage. I need to sign up for Part B. I need to get my Part D drug plan. I want to enroll in an Advantage plan. I want to pick a supplement. That's a special enrollment period. Loss of credible drug coverage, moving from one state to the other. Your Part D plans are usually state specific. So you might see a slightly different premium for the same Part D plan if you live on the Kansas side of State Line Road versus the Missouri side of State Line Road. And if you literally moved across the street, you might have to re-enroll in a plan because now you've moved from one state to the other. There are a lot of special enrollment periods. We can help you sort through all this stuff. I do it all the time. So, all right. So we've gone over Medicare Parts A, B, C, and D. We've looked a little bit at Medicare supplements and how they contrast with Medicare Advantage. We've talked about how to minimize and avoid Part D penalties, Part B penalties. So I want to take a look at a couple of scenarios that we've made up and ask you some questions to see how this has helped you. Okay, our first scenario is Bob and Carol. Well, it's March 2nd, and Bob is 68 years old. He's retired already, and he's had employer coverage in addition to his Medicare through his wife Carol's employment since he was 65. He's got his Part A on his red, white, and blue Medicare card, but he didn't sign up for Part B. And now he's losing the employer coverage because Carol's turning 65 the end of the month, and she's planning to retire and go on Medicare Part A and B and go off the employer plan. So what do Bob and Carol need to do, considering today's March 2nd, to ensure no interruption in their coverage come March 31st? Well, first of all, so far they've done everything perfectly here. Bob simply needs to enroll in Part B and add it to his Part A. And Carol is going to need to enroll in Parts A and B by March 31st in order to have her coverage effective on April 1. That assumes that she's not drawing her Social Security, because if she is, she would have been automatically enrolled. Now keep in mind, Social Security office facilitates filling out the paperwork. Bob is going to be asked to have Carol's employer sign off on a form verifying that the reason he doesn't have Part B is he had coverage through his spouse's active employment for him to avoid any late penalties, and that's usually not a problem. Once Bob and Carol have applied for their A and B, they can start shopping for a standalone Part D drug plan. They can look at a Medicare Supplement in their area. They could also choose a Medicare Advantage plan that has the Part D drug coverage if that Advantage plan, is available in the county or state that they live in. So they've done everything perfectly. They're looking at if they follow those rules, no delayed coverage, no late penalties, poof, beautiful. So now we're going to take a look at scenario number 2, what I call Mary's Dilemma. Well, Mary's 74 years old. She takes very little medicine. She's been on Medicare for 9 years. I spend $4 a month each for 2 medicines. Why do I want to sign up for a Part D plan? It's a waste of money. Well, it's May, and she's just had a heart attack. Everything's fine now, but her doctor, her cardiologist, has now got her on 2 brand name medicines that cost over $400 each and every month. What happens to Mary now? Well, since it's May, Mary's next chance to enroll in a Part D drug plan is October 15th through December 7th, that annual enrollment period time window for you can fill paperwork, but your coverage doesn't become effective till January 1. So she's going to have to pay 100% of the cost of her medicine, or she can see if she can get some of the manufacturer's assistance programs. Typically, these are based on income. When she enrolls in a Part D plan, assuming that she does, she's also going to be subject to a lifetime late enrollment penalty of 1% for each full month she was eligible for Part D but not enrolled, going all the way back to when she was first eligible for Medicare at age 65. So if you got 9 years, 65 to age 74, times 12 months, that's 108 months, or 108% of the benchmark is her Part D late enrollment penalty. And the benchmark in 2020 is $32.74. So times 108, that's $35.36. So Mary has a penalty added, assuming she signs up, of $35.36 plus her plan's premium. But remember that nearest dime rule. Medicare rounds up to the closest dime, or the next highest dime, So she's going to pay $35.40 if she chooses to enroll in a Part D plan at the next annual enrollment period. So the end result of Mary's decision is that she cannot obtain Part D coverage until the following January. So if it's May, she's got May, June, July, August, September, October, November, December to pay 100% of the cost of her medicine. And assuming Mary does enroll in a Part D plan, she's going to pay that premium plus the $35.40 each month for the rest of her life. Now, some people hit me on this and they say, well, $35.40, and again, depending on your income, that may or may not be a big deal. You can argue that she got away with not paying premiums for 9 years, so she saved a little bit of money on the front side. I'm not advocating one or the other. I'm just letting you know how it works and what you may need to take into consideration. Okay, finally, we're going to take a look at Dick here. Dick's early retirement offer, I like to call that. Dick's 63 years old, he's single, and he's worked for Acme Company fresh out of college over 40 years now, and the company is having some downsizing, and they offer him an early retirement offer, a buyout package, if you will. And this includes much of other stuff, but it includes, we're going to give you, Dick, 1 month of employer insurance health coverage for each year you've been working for us. And Acme's a big company. They employ a bunch of people. So Dick does the math. He's going, well, I've been there 40 years, so I'm going to get 40 months of free insurance. and nothing in the package says I can't go get another job. So why not? I'll take the package. I'll take the money and run. Take my free insurance. It'll last till I'm almost 67. When it runs out, well, then I'll just switch over to Medicare and get me a supplement. Makes sense, right? Well, Dick does enroll into Medicare Part A when he turns 65, since he doesn't have to pay a premium for Part A, but he declines Part B. He does not want to pay that premium. And he's got, well, shoot, I still got 18 more months of free health insurance from the company. It's worked fine so far, so why not? Well, 6 months go by, and Dick goes to see a doctor, and he shows his red, white, and blue Medicare card with his Part A only on it, and his group insurance card, just like he's always done. 30 days later, he opens his mailbox, and there's a bill from the doctor saying Medicare denied his bill, and so did his former employer's group plan. He's madder than a wet hornet and does not understand what has happened, what's going on. Well, here's the answer. Page 18 in your 2020 Medicare and You tells you if you or your spouse is still working and you have health coverage through that specific employer or union, it may be to your advantage to delay Part B. Dick's not working for this company anymore. And remember, I showed you this chart early on that coverage based on current employment doesn't include COBRA or retiree coverage, non-working, and that's what this scenario is. So in order to delay Part B, you must be actively employed, and employers with 20 or more employees, their coverage is considered primary to Medicare. Retiree coverage, and that's this case here, or COBRA, and we see this a lot with COBRA. While it's very good coverage, because it's not based upon active employment, generally requires the Medicare beneficiary to enroll in Medicare Part B. Also, under federal law, retiree coverage pays secondary after Medicare, and that's where Dick is at now. So, since Dick did not enroll and pay the Part B premium for his doctor visit, which is billed under Part B, he has no primary insurance coverage. It is for this reason that his secondary insurance from the former employer cannot pay, because by law, there's nothing for it to be secondary to. You have to have Medicare in that situation. So here again is that chart we showed you. It's on page 20 of your Medicare and You for 2020. So now Dick is in a pickle. He is going to have to wait for the Part B general enrollment period, which starts January 1st to March 31st of every year, to fill out an application to add Part B of Medicare. He's also going to pay a late enrollment penalty of 10% for each full year he delayed and didn't have coverage, but also to add insult to injury, even though he signs up in between January and March 31st, his coverage for Part B won't start until the following July. Again, you find this all on page 18 of the Medicare and You booklet. So now the problem is, since Dick's coverage won't take effect until July, and if he finds this out on April 1st, he's got to wait for the following January to apply to be effective the following July 1. So I have talked to people occasionally that have to wait 15 months, depending on where they fall in the calendar when they figure this out, to get their Part B in effect, which means there's no coverage for doctor visits, emergency rooms, labs, MRIs, PET scans, CAT scans, same-day surgeries, all that type of stuff. It's very, very frustrating. So always talk to your benefits administrator or your group health plan, how it coordinates with Medicare. If you've got questions about that, pick up the phone, give us a call. We're more than happy to help you with that, and we'll take you right to the chapter and verse in the Medicare and You booklet, so you know you're getting credible guidance on that. Well, Medicare can, in fact, be a very confusing subject. I've tried to go through this fairly quickly and try to keep it engaging. Sometimes you can really get wore out. I hope you enjoyed the program. If you like it, always consider giving us a subscription on our YouTube channel. Maybe even give us a nice little friendly thumbs up on YouTube too. It helps us in the search algorithms with YouTube. If you've got comments, please send us an email, send us a chat. There is comment sections in the YouTube section below. We really like your feedback on it. At this point, I am going to go ahead and open up the phone lines to see if anybody has a question that they want to call in with. There is about a 10-second delay from when I broadcast to where you actually get it here. So I'm going to open up the phone lines, turn off my Do Not Disturb here. And you can start calling us now at 913-361-0331. Excuse me. So we'll leave this up here as we go through. And while I'm waiting for the delay, just in case someone's got a question, I'm going to go ahead and take you on a quick tour real quickly here. This is our AMS website on our home page. And if you're down here on the home page, you'll notice that we've got a link right here to our YouTube channel. So if you come in here, I wanted to show you a little quickly here. We do have all our different videos. There's playlists. Let's take this down. This is in my way right now. Poof. Where did that go? All right. So we've got this down here, but you can go to like our live playlist for previous classes. Remember I mentioned that they're recorded. This will be archived. So if you go into our playlist, you see our Learning Medicare classes, and you can view the full playlist. So like the class that we just did Saturday, it's listed here. And I'm going to mute that volume real quick so it doesn't feedback loop us. But this is where you can give us thumbs up, hit the subscribe button, all that type of thing. But sometimes I'm finding that people don't understand that when you come down here and you see this Show More button, if you click that, number one, this is where we have all of the links to web pages that we mentioned in the description, if there's a place to download a form or something like that. But also, if you noticed, we've put timestamps here on the recording. So if you want to go back and see, I want to review Medicare Supplement versus Medicare Advantage, you can just literally click this timestamp and it takes you right to that segment, just like a bookmark page. So I just wanted to show you that while we're waiting to see if somebody wants to call in with a question here. So, okay, I think I've waited a fair amount of time here. So I'm going to assume that no one's going to be brave enough to call in with a question. So again, love to get your feedback, folks. The phone number here, again, this is my line right here in the studio. I'm going to pull that down. You can always text questions. This is Justin's direct line. He monitors the broadcast in another room here to make sure that we don't have issues. But you can call him directly here or send a text if you got questions. We're more than happy to help you out. If you prefer email, info@AMSKC is our general mailbox. Any type of comments, if you've got a video, a suggestion for a topic you'd like us to make a video, be happy to look at that. So anyway, that's where we're at. Now we want to talk about your next step. So you may be, if you're watching this, chances are you're turning 65 somewhere in the next 6 months to a year. And if you'd like help enrolling into Medicare, make sure you avoid any mistakes. If you call on our main line, 913-214-1080, that's you'll get a push 1 for this, 2 for that prompt, but come in to 2. We're more than happy to help you evaluate plans. We'll help you enroll in Medicare. We can help you enroll in extra help if you think that you might qualify for. We're an independent agency. We have contracts with over 42 different insurance companies. We'll be more than happy to use our specialized software and quoting systems to price you out Medicare supplements, drug plans, Medicare Advantage plans, all of that. We do maintain an office conveniently here. If you're a Google Maps person, go to Google Maps, type in affordable Medicare supplements. You can see our reviews, see our webpage location. And we're just south of the High V at the corner of 95th and Antioch here in Overland Park. So very convenient, normal business hours. And the key thing is, Again, we're independent. We can quote all the different plans for you. And obviously, we've invested a lot in computer technology. So even with the COVID-19 health situation, we can handle meetings and plan enrollments over the phone if you're a little leery about face-to-face contact, and understandably so. We use a go-to-meeting program similar to Zoom where we can do stuff and see you and you see us if you want and share stuff. All of our services cost you nothing. If you choose to use us and you enroll in a plan through us, we receive a commission directly from that insurance company. And by federal law, commissions are standardized or basically equal. So we really don't care what you get. We'd like to have you as a customer for life. We service what we sell, and even if you didn't get your plan from us and you want our help, come by. We'll be more than happy to help you out here. So as the director, again, I'm the director, owner of the agency. I support about 40 different agents. We've got a couple agents that work here out of the office too. But I've always believed that you get what you want if you help other people get what they want. This is a Zig Ziglar quote. If you're more in the 60s, 70s, we might have said, what goes around comes around. So that's my philosophy. If we treat you right, you'll give us referrals, and we'll get we'll get what we need. So anyway, well, that's all I've got for today, folks. Again, I want to thank you so very much for stopping by. I hope you found the program helpful and hopefully entertaining. If you like the program, share us with a friend. Please consider subscribing to our YouTube channel. As always, give us a thumbs up if you like the program. We've got a lot more videos on our YouTube channel, and we'll be looking to add more in the future. So that's all I got for now. Thanks, folks. I'm Daryl Russell. Have a great night.